Hello, my name is Dr. Esther Burden-Tay and I'm a dermatologist and clinical researcher in Nottingham. Psoriasis can cause rashes anywhere on the body. It can affect both adults and children, and for many people, it's a long-term condition. Psoriasis can have a big impact on people's quality of life and can also be linked with other diseases, such as inflammatory arthritis, which causes swelling and stiffness in the joints. It is therefore important that psoriasis is diagnosed early and accurately. Psoriasis in children and young people can be harder to diagnose than in adults, and harder for doctors and nurses who don't specialise in skin conditions to recognise. This may cause a delay in a diagnosis being made. Until now, we haven't had a list of skin changes to check for when looking for psoriasis. We call this list diagnostic criteria. These criteria can be used by doctors and nurses to help make a diagnosis of psoriasis. We wanted to create a short and usable list of diagnostic criteria that work well at finding psoriasis in children and young people. This was the purpose of the DIPSOC study. In the DIPSOC study, two groups of children and young people were invited. One group had psoriasis and the other group had skin rashes that looked similar to psoriasis, for example, eczema. In total, 330 children and young people took part. Everyone in the study had their skin looked at by a researcher to see if they had any of the skin changes on the list. We then looked at how well the diagnostic criteria worked at finding psoriasis and correctly placing children and young people into the two groups. The DIPSOC study found that there was a list of 7 diagnostic criteria that work well when we're trying to find psoriasis. The criteria asked doctors and nurses to look at the scalp, inside the ear, over the body, at the backs of the elbows and front of the knees, in the belly button, and in the creases of the groin, as well as asking if someone in the family has psoriasis. If they find 2 or more of these skin changes, then it is likely that the person has psoriasis. We would like to thank all the patients and families who took part in the DIPSOC study and all the doctors, nurses and researchers who supported it.